Medical insurance. You will have medical insurance from Boeing until September 30th, 2024, so the end of the month. We don't have much time left. If you have any doctor's appointments, you want to make sure you take care of that. You want to take care of refilling any prescriptions you can now. Refill them for as long a duration as you can right now. If you're eligible for, you should be eligible for COBRA after the end of the month. Boeing right now has been mailing out everybody's COBRA information to you. If you haven't gotten it already, it should be there within a few days. It is fairly expensive, but you'll see the cost breakdowns of it. There's more information on COBRA on our website at iam751.org/strike2024. There's a document there for medical options while you're on strike. So it is one of those things that you do need to look at and weigh and decide all of your options. The cost of COBRA coverage versus the cost of any other options you might have available to you, and to keep in mind the possibility that in past strikes they have included retroactive medical and reinstatement at the end. It can't be guaranteed at this time, but it is a possibility that that could happen. Okay. Pass it on.
So again, thank you for being here, and thank you to IAM for inviting us. We're here to offer resources that we hope will be helpful to you all. And let's get started. Our agenda is the next slide. First, we're going to talk about health insurance and your other options besides COBRA. We'll talk about some state and local support services, the WorkSource centers, the community and technical colleges. We'll touch briefly on unemployment insurance information, and Washington State Labor Council will finish us off. So I'd like to welcome Marie Cooper to talk with you from Washington Health Plan Finder. Marie.
All right. Hi. Good afternoon, everyone. Thanks for joining us here today. So as Joe mentioned, we'll be ending on September 30th. You will have some options to there are some options that are available to you. I'm going to go over that with you so you can avoid having that gap in coverage. All right. So COBRA is an option. So COBRA is not a new plan. Basically what it is, it's a federal mandated law where your employer is required to have to offer you the coverage that you're currently on and to offer you to continue on that coverage. So it allows for you to continue your current health plan, your dental plan, and your vision plan. Sounds like those letters are going out, so you should be receiving them if you haven't received it yet. But you'll notice that COBRA can be really expensive. That's because it is 102% of the cost of that plan. So typically, you pay a portion, your employer pays a portion, and there's a 2% administration fee. When you go on COBRA and you continue that plan, you are taking on that entire cost of that plan. So that's where that 102% comes in. So when you get your notification and you see that, oh gosh, this is, double or even more than double what my cost was when I was on, when Boeing was paying a portion of that, that's the reason why. However, there are times where it may make sense for somebody to stay on COBRA. One, we're kind of towards the end of the year. So if you have already met your deductibles for the year, another reason maybe would be, you are currently getting treatments for something and you have a plan, like a treatment plan with your doctor, and you don't want to disrupt that, or you don't want to go to finding new doctors. That might be a reason where you would want to stay with COBRA or enroll in COBRA. You do have 60 days to enroll into COBRA. So just kind of keep that 60-day enrollment window in mind. And that 60 days starts from when you are losing your coverage, your last day of coverage. Another option is our health insurance marketplace in Washington. That's called Washington Health Plan Finder. Um, this is usually the more affordable option because you may be eligible for subsidies or savings that can help lower your cost of insurance. This is also where Washingtonians can enroll into Medicaid, which is, or Medicaid, Apple Health and Medicaid in our state. You also have a 60-day special enrollment window to enroll on Washington Health Plan Finder. And I'm going to dive in deeper, talking a little bit more about Washington Health Plan Finder. Another option for you would be enrolling into your spouse's plan, or if you're under the age of 26 or 26 and under, you can enroll into your parents' plan. That usually is a 30-day special enrollment window for you to enroll, but I would, work with your spouse or your parent and their HR department to figure out the details on that.
Excuse me, before we go on, I forgot to mention to folks that we are using the Q&A feature on these webinars, and you'll notice a little box that says Q&A. You're welcome to type questions in there. Periodically, we'll answer those questions. Some of them will be answered as we go in the chat box. Some of them, if we have additional time at the end, we'll also answer verbally. So I just wanted to point that out to you, and I apologize for not mentioning it before. Thanks. Go ahead, Marie.
Great. Thanks, Donna. And we can move to the next slide. Thank you. Yeah. So I'm going to talk a little bit more about your coverage options through Washington Health Plan Finder. And I apologize, I cannot remember if I introduced myself. So my name is Marie Cooper. I'm with the Washington Health Benefit Exchange. And so I'm going to talk to you a little bit more about, your coverage through Washington Health Plan Finder. So the exchange, to give you some background information, we operate Washington Health Plan Finder, which is our state's health insurance marketplace. This is where 1 out of every 4 Washingtonians access high quality health and dental insurance. It is a marketplace. So there are multiple plans and multiple carriers all in one place to really allow for you to be able to find the plan that best fits your needs. So what your budget needs are, and then also what your medical needs are. This is the only place where you can get access to federal and state subsidies that can go towards your monthly cost of insurance to help bring that down. And then also, this is where Washingtonians can sign up for Washington Apple Health, which is Medicaid in our state. All right, so the cost of coverage. So when you fill out your application on Washington Health Plan Finder, you'll get an immediate eligibility result. What it's going to look at is your household income and your household size to determine if you're eligible for either Washington Apple Health or a qualified health, qualified dental plan. So if you are eligible for Washington Apple Health, it is free or low cost. If you're eligible for qualified health, qualified dental plan, those prices vary, and that's based primarily on your age, household income, and then also the county that you live in. That's because those are the main factors that determine the amount of savings that you can receive, and then also what plans are available in the county that you live in. So I can say, those savings can really help drive down the cost of insurance. So we have people who are receiving the max amount of federal savings and the state subsidy, and they have premiums that are $10 a month. And those are people who are not on Apple Health Medicaid. So not saying that everybody is eligible for that and everybody's plan is going to be $10 a month. They are still going to look at your household income, household size to kind of determine that information on what your subsidies are going to be, those savings are going to be. But I always like to just kind of give you just an idea that, even if you in your mind are saying, Apple Health, I know it's going to be a lot of money. It may not be, especially with your change in income. You may be eligible for these subsidies to help drive down that cost and make it more affordable for you. All right, so when can you sign up? So for those that are eligible for Apple Health, you can sign up year-round. For qualified health, qualified dental plans, you typically have to enroll during our fall open enrollment. That starts November 1st to January 15th for the following coverage year. So you can see that we are currently outside of open enrollment, but you are able to enroll outside of open enrollment if you experience a qualifying life event. So for you all, your qualifying life event would be loss of employer coverage. You are losing your employer coverage on the 30th. So that's going to open a special enrollment period for you to be able to enroll now. Um, Keep in mind, there is a 60-day window for you to enroll. We kind of talked about that in previous slides. So you do need to enroll within 60 days before or after losing that coverage. So that 60 days is applying now. So you can enroll into coverage right now. And that would be what I would encourage for you to do. So you can have your coverage start October 1st and avoid having a gap in coverage. All right, so here's our official website. It's www.wahealthplanfinder.org. We also have a mobile app. It's WA Plan Finder. You can just download that from your app store. When you're on a homepage, when you're on our homepage, this is what it looks like, just to make sure you're in the right spot. I'm going to point out a couple of things on this page. The menu bar that says, what would you like to do today? And then the Get Support button right in the center of the screen there. I'm going to kind of talk about that in the later slides, but if you can just kind of visually see what that is, you'll kind of have an idea when we start talking about that. All right, so that menu bar, what would you like to do today? A couple of things I want to point out. One is the browse and compare plans option there. If you are curious and you want to know what savings you're eligible for and what plans are available in the county that you live in, you can use that option there and you'll be able to get that information. The savings that you're gonna see on the screen, that is an estimate to actually get the most accurate amount of savings that you are eligible for. You will want to select apply now to fill out an application. Filling out an application does not require for you to actually have to enroll into coverage. There was a hard stop. After you submit, you'll get that eligibility result like we talked about earlier. And then from there, you'll see your savings. And then there's a few additional steps where you actually have to enroll into a plan. So just know, it's safe to fill out the application. Don't feel like it makes you, is making you have to enroll. When you're looking at the different plan options. So there's quite a bit of plan options. But I would say look out for the ones with this logo next to them. The Cascade Care logo that you see in the middle of the screen. These are our Cascade Care plans. So these are our high value plans. So they offer more services before deductibles. So really, they offer more services before any out-of-pocket costs are occurred on your end. They are our most popular plans. They're offered by all insurers, and they're available in all counties. All right. So just some information on reporting your income. So when you report your income, you're going to want to put in all your taxable income for the year. And then you also want to include all your household members. So that includes, so the reason why you're going to do that is because you want to make sure you're capturing everybody, even if they're not applying for coverage. Okay. So say you have a spouse and, they get coverage through their employer. You want to put, and so they don't need coverage. You still want to include them. Okay. And that's because if you remember, the amount of savings that they are offering you is based on your household income and household size. So, your income is going to you're basically making sure that you're maximizing the amount of savings by including everybody in your household. Okay. There are two ways that you can report your income. There's point in time, where you're just putting in everything that you received for the year so far, or an anticipated yearly income where you're basically going to anticipate the amount that you're going to make during the year. Okay. Um, it can get a little sticky on reporting income. So I do encourage you to work with either a navigator or broker, and I'll tell you how you can get in contact with one of those, but they are going to be the best ones to help you in reporting your income. They'll, look at the different options and find the way to best maximize for you to get the most savings and report that. The biggest thing is that you don't want to underreport your income and then receive tax credits. Because if you do that and you underreport your income, you may have to pay back those tax credits at the end of the year. So just make sure that you are trying to be as accurate as possible when you're reporting your income, but also seek help from, a navigator or broker to help in reporting that. All right. So we have free enrollment assistance available for you statewide. On our homepage, if you select that Get Support button, that will connect you with a navigator or broker in your community. We also have a customer support center. There are numbers on the screen. They offer language assistance in over 200 different languages. Our sister network is great. I mean, they are able to help you fill out your application from beginning to end, help you with just questions you have. So if it's just you wanted to start the application and then you just had questions on reporting your income, they can help you with that. Our brokers, also known as producers, they're able to recommend plans to you. So if there is something that you need from your health plan, for instance, there are certain medications that you need, or certain providers that you want to make sure are in network, they're able to recommend plans to you and really kind of look at those different plans that we have. I can tell you there is a lot of plans. We have like 87 plans on our site, so that can be plan overload. So it's nice to know that there's somebody there who's able to kind of walk you through choosing the plan that's best for you at this for your needs. All right, so this is just some information on our sister network. We have lead organizations that we partner with. You can see that we have assistance across the state. And then our next slide shows that contact information for them if you'd like to connect with one of them. And then our enrollment centers, and they're able to assist as well. So just know that there is a lot of help out there for you to enroll into coverage, understand your coverage options. Again, even if you are just curious to know what savings are available to you, you can use that browse and compare plans option, or you could connect with one of these navigators or brokers or customer service reps to really kind of figure out what is available to you and what options would look like. Yeah, the biggest thing is just knowing that there are these options here so you can avoid having that gap in coverage. So I am available to answer questions. If you would like to put them into the chat, I'm happy to answer those. And I apologize, there was actually something that I remember that I do need to let you know. One is a question that came up in the last session, and I want to make sure that I address this, is that pre-existing conditions. So all of our plans are regulated plans. And so they have to meet certain requirements to even be on our platform. So they have to cover things like preventative care services. They have to cover doctor's visits, ER visits, mental health services, prenatal care. These things have to be covered within our with all the plans that are on our platform. Also, nobody is denied coverage for a pre-existing condition or rated on a pre-existing condition. So if you go to a different insurer, there's a possibility if they could rate you and if you have a pre-existing condition. So make your insurance a little bit more expensive if you have something. So that's something that we don't do here on Washington Health Plan Finder. The other thing I wanted to make sure to let you know is that when you regain coverage, So once that all comes back into effect, you will want to make sure that you reach back out to one of our assisters, so our navigators or our brokers, customer support center, to make sure that you cancel that coverage with us. The one thing you don't want to do is be double covered with your employer coverage and then our coverage. Being double covered can cause for you to have to pay back any tax credits that you received. So just make sure, once you get that coverage regained, that you come back in, let us know so we can cancel that coverage for you. All right, so I know that there are some of you that are impacted and you live in other states. So Washington Health is Washington's exchange, that's Washington's health insurance marketplace. Oregon has their own, and so does California. So these are the links for them. They have their own, not everything is exactly the same. So you will want to reach out to them to kind of figure out what you're eligible for. And that's it. But thank you so much for your time, everyone. And I'll go in and answer these questions. If you have any questions, please put them in the chat, or sorry, in the Q&A box.
That's great, helpful information, and I know there will be questions. And again, go ahead and type your questions in the Q&A box. Some of them we will get to during the course of the presentation, and also afterwards. We'll be happy to stay for a while and we can answer questions in there. Regarding unemployment insurance, we'll be getting to that in the presentation. And if there's still questions after that, we can answer those. Next slide, please. So one of the ways that people get support, as you probably all know, is through Washington Connection. So if your family, for instance, was eligible for food assistance prior to the strike, you're still eligible for food assistance, probably based on that income, but it won't increase because your income is now reduced. That's what I've been told by DSHS. It will remain the same based on that income that you had when you were working. There may also be resources for cash assistance, childcare, housing, or transportation. And there is a QR code there. If those are services that you think your family is likely to need, please do go ahead and investigate that. Next slide, please. And again, Washington Department of Social and Health Services is the agency in Washington that coordinates most of those services. We don't have a speaker from DSHS today. We're providing this information on their behalf. And again, with that change in income, you may be eligible for other assistance. Also, each area has a 211 phone number. It's information for local resources and assistance in your community. So that's another resource that's available to you all. Next slide, please. And now I'm going to hand it off for information about WorkSource. Nicola Moore. Take it
Hi,
away.
everyone. I'm Nicola Moore with the Adult and Dislocated Worker Program at the Snohomish County WorkSource, here to tell you about what WorkSource is. Next slide, please. So WorkSource is a federally funded partnership of state and local organizations that provide employment and training solutions at no cost. And the reason we wanted to highlight WorkSource as a service and a resource for you is because while you are still employed, you may have members of your household or your family that are needing to go to work because of current circumstances. So WorkSource services are available across the state, offering comprehensive one-stop resource centers and affiliate and connection sites where you can access WorkSourceWA.com, which is our online service portal, and receive some of those additional community supports. So next slide. So in addition to hosting workshops, job fairs, having jobs bulletins and having jobs postings online, WorkSource can help with career exploration, resume review, general resource navigation. There's also a wide variety of programs offered at the various WorkSource locations that can help fund things like trainings, apprenticeship programs, certifications, So no matter where someone is at in their job search, whether this is their first one or their first one in over a decade, there's a program at WorkSource that can help folks meet their goals. Some of the programs we have and partners we have under our one-stop roofs are partners like the Workforce Innovation Opportunity Act programs, Veteran and Youth Services, partners like DSHS, DVR, LNI, all kinds of alphabet soup. Um, so we hope to see you at a WorkSource in your area, which brings me to the next slide, please. If you are tuning in from the Snohomish County area, we do have one comprehensive center in Everett, and that is at Everett Station in downtown. You can also find us online at worksourceonline.com. We also partner with all of the libraries in Snohomish County to offer those virtual services as an affiliate site, and then you'll find staff at Volunteers of America, Edmonds Community College, and the Latino Education Training Institute. So while we only have one comprehensive center, we do have staff across the county ready to help and support. And with that, I'm going to turn it over to Claire to talk about what's happening in King County.
Hi, thanks, Nicole. My name is Claire. I am with the Workforce Development Council of Seattle-King County, and I would like to share more about what Nicole said, but here in King County in Seattle. There are 5 WorkSource offices in King County: Auburn, downtown Seattle on 3rd and Virginia, North Seattle College, South Seattle College, and Rainier Avenue. All of the resources that Nicole mentioned in Snohomish County are also available at WorkSource in King County. Again, they are absolutely free for you or your family and friends to use, and they offer a wealth of both upskilling, job training, and other wraparound services. You can find help by scanning the QR code on the slide right now. You can also visit the website by going to worksourceskc.org. That SKC, again, is specific to Seattle-King County. Thanks, everyone. Oh, yeah.
And if you are tuning in from Pierce County, some of their local resources and partners are United Way's South Sound, who runs the 211 line. That is a great entry point to getting any services you think you might need, because they can provide wraparound services through that. And then WorkSource Pierce, of course, their one stop is located on State Street in Tacoma. If you've got questions or if that's in your neck of the woods, you can contact Dion, whose contact info is listed on the screen. And then they have been looking at their partnerships with some of the temporary employment agencies in Pierce County. So if you are looking for temp work, there are a few resources listed on the screen there for you. The next slide.
Hi, my name is Laura Wood, and I'm in Moses Lake at WorkSource Central Basin. I work for Employment Security Department, and we are located in downtown Moses Lake by the police office and the library. And we are open Monday through Friday from 8 a.m. to 5 p.m. And just like what's been described, we are a one-stop center. And so we have a resource room with computers that are available to apply for healthcare benefits, DSHS, work on a resume. You're welcome to come in and use the computers at any time. We also have partners there as part of our one-stop. We have partners that we can refer you to and help with other resources, including training resources, etc. We do have a contact in our Moses Lake office, and his name is David Nava, and you see that on the screen, and you can contact him at 509-766-4114, and he'll be able to connect you with other resources. Thank you.
Thanks, Laura, Nicole, Claire, Marie. Great information so far. And I bet you're thinking, why are these people telling us about WorkSource? I have a job. I'm going back to my job. I hear that some folks are going to need temporary employment during this time, that it's a lot to not be going to work and have your regular salary. So like in Pierce, each of these areas have contacts with temporary agencies in your area that may be able to help you find some fill-in type of job, and they can help prepare you to apply for that, to interview, to fill out your application, to get your resume together. You also may have family members because your circumstances have changed, maybe a young adult, maybe a spouse who's thinking, this may be a time when I need to get a job and contribute to the family in a different way than how I have in the past. And WorkSource has resources for those folks as well. So we're not trying to get you to leave Boeing, but we are offering that you may need temp work while you're on strike, and also that your family may be looking for work or services during that time. We fully recognize that eventually y'all are going back to work. And we're looking forward to that day for you when you have a contract that you can agree to. Next slide is for you, Nicole.
Awesome. I'm glad you brought up families because I think that transitions well into the workforce education slide. So next slide, please. Workforce education or worker retraining programs are available at any community and technical college. So no matter where you are in the state, there is a college or a program near you that can help help you or your family get assistance and support entering or re-entering the workforce through career training. So different colleges offer different programs based on what is in demand in their area. Those worker retraining dollars can cover up to 3/4 of tuition, books, and fees. And then other programs like the Workforce Innovation Opportunity Act can sometimes come in at the tail end and cover any other outstanding expenses around those. But they're geared towards short-term certifications and trainings. The colleges also have dedicated staff and career counselors that can help advise on figuring out career pathways, figuring out what is in demand and what are some of those labor market trends so that whoever's going into worker retraining can be successful in landing employment afterwards in their area. And if that sounds of interest or you want to share this out with your household, next slide. The first step you can take is to look at training providers and some of the occupations in demand. So if you go to Washington Career Bridge, you can scan that QR code or you can type it in your search bar, but they have different filters to look at labor market info, programs by area, and programs by certificate or area of study. So once you've got a sense of what training you might be interested or certification you want to pursue, next slide, then the next step would be to go to startnextquarter.org. You take a 2 to 3 minute survey to see what programs are in your neck of the woods or in your neck of the virtual world. Some of those courses are offered online. And if you do have questions, just a reminder to please put them in the Q&A box so we can answer them. Happy to take any questions through there about WorkSource services or worker retraining options for folks.
Thanks, Nicole. And our next topic is unemployment insurance. And I understand it is a picket line conversation. So I'm glad we're able to speak with you directly about this. Next slide, please, Emmanuel. A labor dispute or a strike. A labor dispute is a strike or a lockout. And in your situation, of course, it's a strike. When your colleagues, the firefighters, were locked out, that was a lockout. This is a strike. So that is a determining factor for unemployment insurance. Striking workers generally are not eligible for unemployment insurance. Now, as an employee of ESD, I can never tell you not to apply for unemployment insurance. You're right, and you may apply for unemployment insurance, but know that being on strike is not an eligibility criteria for receiving unemployment insurance benefits. when you do apply, should you, each case is looked at on a case-by-case basis. But I just want to let you know that in general, striking workers are not eligible. Next slide, please. Again, you would be eligible if you were locked out, or perhaps if you quit your job during the labor dispute, although that's even quitting is not as easy as if you're laid off, for instance, or if you were fired. The one thing that people have asked about is replacement workers. For you to be eligible for unemployment insurance because of a replacement worker, that person would have to be doing your job permanently, and pretty much you wouldn't be working anymore there. They would have replaced you. So it would be a permanent replacement worker that Boeing would have brought in. So the temporary replacement workers that they brought in, I understand, I read the newspapers to do some activities while you all are on strike. That is not what they're talking about when they're talking about a replacement worker. They're talking about someone that's hired on permanently in the position you used to have because you don't have it anymore. Next slide. We're going to move on to paid family medical leave, and I know there's questions about that, and we can take more questions afterwards about unemployment insurance, but the basic message is that eligibility isn't really attached to being on strike. And so once you apply and click that you're on strike, then that puts you in the bucket of people on strike. So just so you know, the system picks that up. If for some reason it got through and you received unemployment insurance benefits for which you were not qualified, so once your case was adjudicated and they said, oh no, that person actually isn't eligible, then you'd have to pay the money back. Now, in general, it's not getting to that because the system flags that this is a person who said they were on strike. So I just want to let you all know that too. And we really don't want anyone to be in a position where they have to pay money back when you're not earning money. So just putting that out there too. We've also had questions about paid family medical leave. If you're eligible for paid family medical leave, you're eligible after you've worked 820 hours in your qualifying period, which is about in the last 12 months before the qualifying event, the reason you're on leave. And it's available when you have a serious health condition that prevents you from working, or some people use it to bond with a new infant or with a child they've adopted, or spend time with a family member who's gravely ill, or care for them, or with a family member who's preparing for deployment. If you're already approved for paid family medical leave, it will continue during the duration of your qualifying event. So for instance, if when the strike started, you were already on maternity or paternity leave, you're still on paid family medical leave until that qualifying event ends. So if you were on paid family medical leave 2 weeks ago when the strike started, but it's scheduled to end today, the 26th, then your paid family medical leave ends and you move into the status of where you are. Okay, next slide. We have some tutorials and information on ESD's website. There is a banner at the top of esd.wa.gov that gives information and frequently asked questions for people who are on strike, specifically for Boeing workers. There's a tutorial about creating a secure Access Washington account. So if you are someone who does need to apply for any state services, fishing license, right? Department of Revenue, whatever it is, that's how you do that. And then of course, WorkSource WA, and we have links to all of those there. The QR code goes to the esd.wa.gov Boeing frequently asked questions. The other thing I wanted to point out, and I hate to have to tell you this honestly, but I've been doing this for a while now with folks who are unemployed. People can be ripe for scams and people who try to take advantage of you when you are in a position that things are not the way they normally are. And I think of myself as really savvy and really smart, but if I were in an upsetting situation or an unsettling situation, it's easy to be misled by things. And so I just want you to be super careful about that. And so, for instance, if these are employment security social media sites. That's the Facebook site, the Twitter site, and the LinkedIn. If you see some other funky looking Facebook page that says it's ESD, if it's not this one, it's not. And that's how you end up with incorrect information or accidentally click a link that you didn't mean to. So just be really careful that you use only the official websites, and that's true for your union too. You know, don't get accidentally carried off into something that puts you in a position that you have a hard time getting away. So we like to point that out to you at all too. We want you to be successful in this endeavor and take care of yourself and your family to the best of your ability. Next slide. I'm going to send it over to Washington State Labor Council.
Thank you, Donna. Can you hear me okay?
Yep.
Thank you. Hi, everyone. My name is Emmanuel Flores, and I work with the Washington State Labor Council. And I'm going to talk about a couple of things. I'm going to talk about how the Washington State Labor Council, or pretty much what is the Washington State Labor Council, who we are, for those who might not be familiar with us, as well as talk about some of the resources that we offer and how they complement or they're in addition to what's being offered here today. And then offer some extra thought on how to leverage, as you've been hearing, leverage the resources, take advantage of them. And most that hear the name Washington State Labor Council, they guess that we work for the state. And we actually are the Washington State Labor Council AFL-CIO. We're a labor union organization. We are contracted by Employment Security Department to help be a labor advocate, to help be an additional advocate, to be your advocate. And I find it, well, I want to reference that your resilience is your strength. Through times that are trying or hard, this is the time where your resilience really leads. And your skills are what's important to keep in mind and to focus on. And leveraging these resources, as I mentioned, is one of the many ways that you can hone your skills if possible, or maybe as you've heard, there's temporary work, and there's different ways to that these resources may be able to help in bridging gaps, or could potentially lead to another possibility where someone else could leverage these resources in your household. And with your power, it is in your skill to adapt and persevere through trying times. And during these challenging times, it's good to have that conversation and see how things could work, see how they could fit. Don't just have like a plan A and just stick to the one plan. Try to get a plan A, B, and C, and try to work those plans simultaneously. And it's important that that as you, pardon me, I'm going to the next slide here. As you are working through the process and everything, be intentional with what your next steps are going to be. Be intentional with how you work your plans, and keep in mind that your network is going to be one of the best things to leverage. And we hope that what you're experiencing today as your network is growing. Like, today is not about memorizing all the information and all the things. It's just about knowing what the next steps are, having a couple of plans, and trying to get some information so you know what to do next. And we're hoping that what you're experiencing is your network is growing. And most people's network starts with friends, family, your community. In this case, you also have a union, you have each other. And through your strength, like, you are strong, you are united, and we see that you are ready to support each other. And those that are here presenting, talking about these resources, or those that you might interact with, they recognize that these resources are made or they're ran by people who recognize in supporting each other during trying times. So I really want to encourage to leverage what you've heard here today, to leverage the people that's here in a way that it can help you either bridge that gap till things resolve, or potentially it might create a space for someone else in your household. If you have, if you feel like you are trying to access these resources and maybe you just need an additional sounding board to bounce things off of, or you feel stuck, feel free to give us a call. Most people that get connected with these resources do well in pursuing whatever it is. But every now and then, sometimes people hit a gap, and just know that, excuse me, every now and then people hit a snag, and just know that we're here as an additional resource to help try and navigate and figure out those next steps. Thank you, and back to you, Donna.
Thank you. And let's send it back to Joe to finish us up for today. And thank you so much for attending. We do have some time. It's only 5:48. If you have other questions, go ahead and type them in the chat. And we have a few minutes to look at more questions. Joe.
Yeah, so we'll go ahead and go over some of these questions. We've had quite a few about COBRA. And I just want to reiterate, yes, COBRA coverage, the questions that keep coming up, if you enroll after October 1st during that 60-day window, that coverage would be retroactive to the 1st of October. Even if it occurred, even if you signed up after having to use the insurance, it would still cover those expenses. Looking through. Okay, we have another one. Will it be possible to apply for FMLA during strike?
If you experience a qualifying event during the strike and you have all your doctor's documentation and everything, short answer is yes. If you have a qualifying event that would normally qualify you for paid family medical leave through the state, then go ahead and apply, because the qualifying event is separate from the strike.
I do want to note that there will be a recording of this webinar available. We're going to be posting it to the IAM751.org/strike2024 page. On that page, you'll also find resources, including links for job search information on COBRA and other healthcare options, and other things that may be available to you. Question. For questions about the debit card, I'm not familiar with what's going on with that in regards to that. I'm not a part of the issuing the strike cards. I would direct the call to the Union Hall 206-763-1300, or you can email the info@iam751.org email address.
Hey, Joe, there was a question here and I answered part of it, but then referred them to you to kind of further answer their question. I think they may be asking, but the question was, if I buy the insurance through healthcare finder, health plan finder, my Met deductible will be reset. And that was a question. I'm not sure if you're seeing it under the answered. But I replied that if you get coverage on Washington Health Plan Finder, this is a new plan. So you're kind of starting your deductible over again. But I'm not sure if they were wondering about their previous plan. If they don't go on Cobra, maybe I think is maybe what they might be asking. So I answered that
That
first part, but not quite sure on the second part of it, if I was answering that correctly. Yeah.
that depends. If they're reinstated in the same group benefit plan, or if they enrolled in Cobra, your deductibles and out-of-pocket maximum contributions would be the same. But with regard to anything from the healthcare plan finder, that would be totally different. Another thing to consider too is that if insurance lapses and it's not reinstated or anything of that sort, returning to work may be a qualifying life event for you to enroll in a different plan, and that would change your circumstances as well. It would really depend on if you are continuing enrollment or re-enrolling in the same plan or not. So with Cobra, your deductibles that you've already paid this year are still going to be the same deductible. So if you've hit your full deductible, if you've hit your out-of-pocket maximum, you'll have hit it. Cobra is just a continuation of the same plan.
Yeah, and that's sometimes where it would make sense for somebody to really consider going on Cobra, even though it may be expensive. If you already hit your deductible for the year, that may be a good reason why you would want to, pay what the current cost is and continue on that plan.
Yeah, the deductible won't reset.
Hmm.
So the question was asked if the agreement to pay all medical, like the last contract, will we get reimbursed for the premium we paid for Cobra or insurance via the healthcare finder? If it was like the last agreement, they would reimburse for Cobra. They would not do anything for the healthcare finder. I don't see them doing that. Okay, and then another question is, what about all expenses when I used insurance via healthcare finder? Again, this is something in the past they have reinstated medical uh, retroactively at the end of a strike. That is come in different forms after different strikes. It really depends on what is in the settlement agreement, and we don't know what that would look like or if it would be included until the end of this. Okay. Give it another moment. Okay, it was asked, can we expect the same support via work life while on strike? About the same kind of support that you've been getting from work life. If you call the hotline, just understand that on October 1st, it might be a little bit busy when you ask for health and insurance. But yeah, work life is still supporting your questions and requests and whatnot. Same phone number, same everything. Okay, and Ernest asks, when we go back to work, will it be considered open enrollment? Meaning, will a spouse be able to get back on the Boeing plan? It is possible if coming back to work, that is one of the conditions that triggers a special enrollment event for Boeing health insurance. So at the end of a strike or lockout or a long-term LOA, those would be considered a qualifying life event for the Boeing plan, and you may be eligible to make changes to your plan.
Wanted to mention too that in some of the union halls, the WorkSource staff are coming down a couple days a week. And so they can chat with you if you have questions for you and your family about, again, temporary work or any of the other services that are offered. Starting next week in King County, I think they're doing 2 days a week. And I'm not sure, Nicole, what's happening in Snohomish County.
Yes, I was actually just typing that out to everyone. For folks in Snohomish County, we will have WorkSource staff at the Union Hall on Wednesdays from 10 to 2.
Okay. You use your current. Okay, someone asks the question if you use your current medical card if you are on Cobra. The answer is yes. There will not be issued a new card if you're enrolling Cobra. And then, all right. I'm not seeing any more. Good to hear, Dave, that you got your 7 kids signed up for health insurance through the Washington Health Plan Finder. Bet it was a lot cheaper. So concluding this, we are going to have this this entire webinar posted on our site. We're going to have another one next Tuesday in the morning at 9 a.m. and then another one next Thursday at the same time. we'll continue this going. We'll have this slideshow posted as well. So, and then we're also going to be reviewing the questions and looking at an FAQ to put out as well. Okay.
And then Marie, I'm not sure if you saw in the Q&A, there's a question in there. Can we find out the premium before we buy the insurance? Or when they see that premium, do they have to purchase?
Oh, thanks. Thanks for pointing that out, Nicole. Yeah, so you can see the monthly cost. There's kind of two ways you can do it. One is that you can use that browse and compare plans option. That'll give you, that's on our homepage. If you remember when we went through it, it's in that menu bar. So that would give you an estimate of what your savings could be, and then also what plans are available in the county that you live in. Um, if you fill out an application and you submit that, it'll also give you an immediate eligibility result that actually is the most accurate amount of savings you can receive. So once you put in that information, it does take a little bit longer to fill out that part, but it'll kind of get you set up if you're kind of wondering, but then it'll get you ready to go into just picking a plan right afterwards. But filling out an application does not require for you to actually have to enroll into coverage. That's a safe way to kind of find out what savings you're eligible for. There are kind of a few steps that you have to take in actually enrolling into a plan. So there are ways, yes, that you can see what the cost would be for you, for your family, before actually enrolling into a plan. You have kind of two options there. Are everybody able to see the questions? Just wondering. Are they all the
All the
participants?
answered ones are posted.
All the answered ones. Oh, great. Okay. Because I just wanted to everybody to see that, some people are kind of putting their experiences of enrolling on Washington Health Plan Finder, and that they found it to be a lot more affordable than what their COBRA cost would be. So that fills my heart. That makes me feel good that you all are looking at your options and that you're getting covered. But I wanted to make sure that everybody was seeing that, some people are putting some really great things in here of it being, a lot more affordable than what it would be to enroll into COBRA. So thanks for sharing those experiences as well with everybody, so everybody can see that, and hopefully everybody can get the coverage that they need, so they can avoid that gap.
Okay. Okay. I'm not seeing any more questions coming in, so. Okay, well, again, if we're going to have this again next Tuesday at 9, next Thursday at 5 p.m. So we'll see you all there.
Thank you, everybody.
Thank you, and best to you all.